why, you know what, I'm slightly passionate about that. But of course, as always, and do you think that you could be at risk of developing cardiovascular disease? Well, you know what? There are ways of predicting heart disease risk. So why? So you can begin treatment early before it happens. Here to discuss the value of how accurate preventative assessment is so important, Mayo Clinic cardiologist Dr. Reza Arsanjani is joining us here this morning. Good morning.
Good morning.
Thank you, because we've been having a lot of discussion this morning. The thing is that preventative is really the key, and you offer options for patients who come in to see you to assess what their true risks are. How do you go about doing that?
Absolutely. So generally, we often use a traditional scoring system where it kind of takes into your age, do you have high blood pressure, what's your cholesterol level. And these are great, these are inexpensive, relatively easy. However, they tend to underestimate what your true risks are, especially in females, and what their lifetime risks are. In addition, they don't take into account your family history, as well as certain other risk factors that go into it.
So, and when we say know your numbers, of course that's important, but you really need to go beyond, one step beyond that. And you guys offer a particular, it's an ultrasound.
Yes.
Explain this to me, and how does it work?
Sure. We do an ultrasound of your carotids, and the idea with it is that you have 3 layers within your carotids, and we look at how thickened is the inner layer. And depending on
what are we looking at here?
So this is actually a CT scan. There's 2 different patients. The one on the left is the normal, and the one on the right is abnormal. What I want to bring your attention to is that the one on the right, you can see the heart is a little bit bigger. In addition, on the left, there's no evidence of calcium, and the white that you see on the right-hand side is actually calcification. And this is actually a very good predictor of what's your likelihood of having future cardiac events.
Really?
Yes.
Okay, this is through a CT scan, right?
Yes, ma'am.
But what you were just explaining to us is in this video right here.
Absolutely.
This is from the ultrasound of the carotid
Exactly.
artery.
And
now, tell me what we're seeing here.
Sure. The one on the left, if you look at it, the inner layer, which is the right in the next to the black area, and the middle, which is a lumen, tends to be very thin. It's very normal. The one on the right-hand side, you actually see that there's a little bumpiness right at where we see the 2 lumens bifurcate, and that's actually plaque. And if you actually have plaque buildup, it actually increases your relative risk of having an event, of having a heart attack by approximately 25%, and having a stroke by 30%. So again, if you see somebody who comes in who doesn't have traditional risk factors, however, the carotids look like the one that's on the right, you want to be very aggressive in initiating medical therapy.
Right, and as we were just saying, you can know your numbers and you can look at your genetics, but you won't know that unless you actually go in and look. Now, this is a non-invasive procedure, right? I actually had this done out at Mayo Clinic, I believe it was last year, and it's very simple. It's just a simple ultrasound, and you can see everything.
Yes, absolutely, and you compare yourself, and the benefit is that you compared it to people who are in your own gender and age, and depending on how much thickening that you have, that could actually, as I said, could significantly increase your risk of having future cardiovascular events.
Now, here's the thing, Doctor, when people come in to see you at Mayo Clinic, you can offer up, once you do this assessment and you look at everything, their numbers and whatever types of preventative measures you need to take, all of this can be done under one roof, under one location. You're not running all over the place.
We offer the entire workup in the same setting, under the same roof, and you can have everything done in the same setting.
And once you work with a patient and you decide whether or not they are, at a certain risk level, you work with them. You have a battery of people, nurses, and
and we follow you pretty closely. And the thing is that then again, it's very important in the relationship that the patient actually is followed closely up with the team, and we can initiate medical therapy and then see how well you respond to that.
Absolutely. You need everybody on the same page.
Absolutely.
Learn that, my lesson. All right. Thank you so much. We appreciate you being here. And let me give you some more information. To schedule an appointment with a Mayo Clinic cardiologist, here's what you do. You call 480-301-8200, or you can also visit their website, mayoclinic.org, to learn more information. It's all about prevention, everyone. So don't forget, ABC 15 is teaming up with Mayo Clinic for our Rally for Red campaign. Each month, we're going to give you easy-to-follow recipes and ideas to help keep you and your loved ones heart healthy. So important. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.